Now, around the world, tough measures are being imposed. Spain's 2-week state of emergency will mean strict restrictions on movement. France and Germany banned mass gatherings last week. Italy remains in complete lockdown, now reporting 21,000 cases. However, Britain is almost alone in not enacting any extreme measures, even as President Trump has added us to the list of countries now banned from travelling to America and is considering all options when it comes to domestic travel as well. Minnie Stevenson has our first report tonight.
Europe now the epicentre of the corona crisis. The hospitals full, the streets empty. Drastic measures taken elsewhere, while in Britain life keeps carrying on, largely uninterrupted. Boris Johnson's words this week, sobering.
Many more families are going to lose loved ones before their time.
Today, the reality for families losing people they love. As NHS England announced, the number of deaths in the UK had almost doubled. 21 patients diagnosed with the coronavirus have now died. While inside North Middlesex Hospital, a baby believed to have become the world's youngest patient with coronavirus. Within minutes of being born, testing positive. The hospital later confirming the newborn and their mother both had the virus. Staff who treated them are now self-isolating.
We are continually following the evidence and scientific advice, and that has been that children seem to be less at risk compared to older people with underlying health conditions. But my thoughts are actually completely with the family.
As the coronavirus crisis intensifies, this morning a significant step for a low-cost airline. Jet2 cancelling all flights to mainland Spain, the Balearics and Canary Islands. Some planes were grounded while passengers were on board and ready to take off. Others turned back to the UK mid-air. The dramatic move came as Spanish streets looked more like ghost towns as they prepare for a national lockdown here, expected to be told to only leave the house for food or medical supplies, with more than 5,000 cases detected, making it the second worst affected country in Europe after Italy. In Rome, they're rushing to build new intensive care units in hospitals as the country continues to live under lockdown. More than 21,000 people have now been infected and over 1,000 have died. An ageing population and a shortage of hospital beds have proven fatal for Italy. As Denmark, Poland and the Czech Republic shut their borders, a tough stance too in New Zealand, where everyone arriving in the country will be asked to self-isolate for 14 days. Meanwhile, in Washington, Donald Trump said the UK and Ireland would be added to the list of countries included in the US travel ban, as the president admitted he'd too been tested for coronavirus.
I had my temperature taken coming into the room.
So did we.
You did? Good.
Yes, sir. Yes.
Let's compare. Do you want to compare?
We did all of it.
Good. Well, that means we're all looking good. I also took the test last night. Yeah. And I decided I should, based on the press conference yesterday. People were asking, did I take the test? I don't know, whatever it takes, a day or 2 days, whatever it is. They send it to a lab.
While the epidemic in China appears to be slowing, the spread of coronavirus has accelerated in Europe. Just how to contain the crisis now rests on the shoulders of governments across the world.
Well, here more questions are being raised over the British government's strategy, with pressure rising from a number of groups, including some leading scientists and school leaders, for the UK to be taking more drastic measures and sooner. Here's Simeon Brown.
A new day, and the pandemic continues to grow at an alarming rate. Over 1,100 people infected, almost 40,000 people tested. Deaths have nearly doubled in just a day. Amidst growing lockdowns and widespread testing across the world, Britain has been criticised for not taking the same action.
After early reluctance to take drastic action, next week the government is expected to introduce new legislation that includes a limit on public gatherings. Life in the UK as we know it is about to change, but as the government steps up its efforts, there are question marks over how effectively it's learning from approaches taken abroad and over the implications of doing so.
This week, Channel 4 News reported on the Chinese surveillance app credited with helping to contain the world's biggest outbreak of COVID-19. The app records the name, temperatures, ID number and movements of users and gives each one a color code. It uses big data to assess each user's risk and check if citizens have come into contact with those infected. But the app comes with controversy. In China, personal data was reportedly shared with the police. And in South Korea, there is also huge privacy concerns over whether the surrender of private data to the state is a worthwhile trade to stop the outbreak of a deadly virus.
And this is now the question facing the UK now. Channel 4 News has seen a paper by leading Oxford academics presenting to launch a similar app here in the UK. And we understand that paper has been presented to policymakers.
This is how such an app would work if everyone had it. Here, subject A has the coronavirus but does not yet know it or show any symptoms. In their day-to-day life, if they come into contact with other people, at home, on public transport, or even at work, when their symptoms begin to show, they can request a test, and if it turns out positive, all the people they had interaction with are immediately notified by the app and told to self-isolate and get tested. The places they have been are then decontaminated. The paper itself also recognises that it requires widespread trust from citizens nervous about how government uses our data.
Misuse of people's data, and we've seen the use of big data to do predictive policing and detain people really for no reason. So there's a concern that although this data is being perhaps collected for a legitimate purpose, that it could potentially eventually be misused in ways that we can't predict right now.
Another big problem is the success of the app in China involves widespread testing, something the UK government is refusing to do.
It is no longer needed for us to identify every case, and we will move from having testing mainly done in homes and outpatients and walk-in centres to a situation where people who are who are remaining at home do not need testing, and we will pivot all of the testing capacity to identifying people in hospitals who have got symptoms.
The policy is making it impossible to know the true number of cases in the UK and also goes against the guidance of the World Health Organization. The government here is trying to leverage herd immunity. This is when the resistance to an infection builds up in a population as the virus spreads. They believe this will allow them to bring in harsher measures at a time they will be most effective.
It's all about taking the right steps at the right time, which will best respond and manage the impact of the virus, and so that we have the best possible outcomes for our population.
Today, a senior government source told Channel 4 News that they've been inundated with brilliant ideas to help. But as COVID-19 spreads, the country is in a race against time to deliver the ideas that work.
We contacted the Department of Health to ask if they had considered app-based infection control as part of their response to the outbreak. They have yet to reply. Well, joining me now from South London is Dr. Claire Gerardo, who was chairperson of the Council of the Royal College of General Practitioners from 2010 to 2013. She tested positive for the virus last week and is now in isolation. Thanks so much for coming on the show, Claire. Tell me, what was your experience like? When did you get sick and when did you test positive?
Well, it's been pretty grim, I have to be honest. It's been like a very bad dose of the flu, which is more or less what it is. I got tested early last week and I was found to be positive on Thursday. The illness itself came on very quickly. Having been completely well coming from New York, I then got a very high temperature, a sore throat, a dry cough, and that was really for about 48 hours, maybe 50, 56 hours. And then the end of it became on very quickly. And though I'm now very tired, the temperature stopped very quickly, the symptoms receded, and I'm now well on my way to recovery. So, you know, I'm a case that's come out the other end. I have to say I've got no underlying health conditions, though I am at the at-risk group. I'm 60, and I've managed it with paracetamol, lemonade, yogurt, and latterly chicken soup.
Right. Well, I'm very happy to hear that you're better, but were you scared while you were ill?
Yes, I was, but you're always scared when you're ill. I mean, it is frightening being unwell, and I think we have to take that into account when we're asking people to be unwell and at the same time isolated. I think we might need to rethink that. It was very helpful having a phone call from the hospital just to check on how I was, that the people who did the testing, they rang twice, which was really, I can't tell you how helpful it was. And of course, as a GP, my colleagues contacted me. But I think going forward, we will have GPs that will be doing home visiting services, clearly for the sick, not we're having to tailor everything. But I would like to say something about testing. We don't test for seasonal flu in general practice, but we can still tell you approximately. We have surveillance. It's because you're not testing doesn't mean that nobody is counting the number of cases. They're counted in different ways. So going forward, I don't think I would be tested now. I'd be told, go home, rest up. If I get short of breath, then contact 111.
And would you be okay with that?
Say it again.
Would you be okay with that if you were ill again, not to get tested, just to stay at home, briefly?
We don't test for the flu. I mean, we've never, as GPs, we've never tested for influenza. So if a patient comes to us with symptoms of influenza, we say to them, quite obvious it's influenza, go home, these are what you have to do. If this happens, contact me. But otherwise, it's a 2 to 4 day illness. This is what you're going to feel like, X, Y, and Z. It doesn't mean we don't have surveillance practices.
Right.
It doesn't mean. So I think we've got to be absolutely clear, because we're not testing now doesn't mean that we're not modelling how many cases there are.
OK. Claire, thank you very much. I'm glad to see that you're recovering. And in coming now is the former North West Regional Director of Public Health and former President of the UK Faculty of Public Health, Professor Dr. John Ashton. John, great to have you on the programme. You heard what Claire had to say there. She's gone through it. She seems quite relaxed about the government policy. Has she got a point?
Well, I'm glad Claire's getting better, but on the testing, we've got a real problem. The failure to test systematically and to do sample surveys of the virus in the community is what's got us to this place now. Let me say this, Matt. With the doubling of the number of deaths today, we are in a grave situation. We're in an exponential upward curve now, leading to large numbers of deaths. We're just a couple of weeks behind Italy, almost certainly. We've got the systemic failure of leadership and action, and we're drifting towards an authoritarianism because of the failure of governments, of the chief medical officer and of the scientific advisor to take the right course of action. I think we're now at a point where, because we need to engage properly with the public, and there's no sign of that at all, Boris Johnson, I think, needs to consider his position.
Well, hang on a minute.
He wanted to so much be Prime Minister, and he's not up to the job. And I think he needs to go, along with his advisors.
OK, John, I don't want to politicize this.
Rory Stewart now needs to come in. John, he's a man who would carry respect.
OK, John,
he's a man of action.
Let's stick to the science, John. Let's stick to the science, John. John, let's stick to the science.
This is a political matter. It's a political
matter. The government is saying, let me just say something. The government is saying that they are following the advice of their scientists. They've considered this very carefully, and they say by delaying, the tactic of delay, allowing some infections to take place, they will get this herd immunity at the end of the day, therefore saving more lives. This is a scientific position. So what's your scientific view of it?
This is flawed. The science is a narrow science. We need total multidisciplinary science here, not just biological science. This is about culture change. It's about the community being in the lead of this, because they're going to have to carry the brunt of it. And for the chief scientist to make these suggestions about allowing the virus to go through the population to get to herd immunity with deaths that might be prevented is unethical, and it's unacceptable, and he should go.
But he is basing that judgment on his science. So we've got an argument within the scientific community pitting people like you against people like him. Who are we to believe?
He represents a narrow science, and we need a broad, multidisciplinary, 360-degree science. We need the lived experience of the communities who are going to have to handle this thing. There will not be enough capacity in our hospitals. We would need about 8 times as many intensive care beds as we've got. As this peaks in May, maybe, or June, we will not have it. People who are really ill are going to have to be nursed at home. We need to be engaging with them. This cannot be sorted by 3 men in London telling people what to do. It's got to be social mobilisation by people who are trusted, and can be believed. And I think Rory Stewart's now got to come in as Prime Minister.
No, you're going too far on this. I don't want to do politics here. I want to do science. So in 20 seconds, John, should we go to extreme measures now?
We will go halfway to extreme measures, but this is a political situation. It's a war situation.
Okay. All right, John, we've got to leave it there. Professor Dr. John Ashton, thanks. Claire, getting back to you, you just heard what he had to say.
Yeah. I think it's politics.
What's your response,
with science.
briefly?
Right, briefly, Matt, it's politics and science. And number two, I think I'm glad John's not leading our response at Cobra. I'm glad that John is not involved in the decision-making tree, because John is ill-informed. And I think what he's doing now is doing the exact opposite of what leading medical profession should be doing, which is be looking and supporting the government, supporting the decisions that they make, which are the right decisions at the right time for us.
Right. Claire Gerada, it is very unsettling to hear experts in the medical profession arguing publicly like this about the right response.
I'm not arguing about the right response. I'm saying the response is the current response that our government is giving us. We're not with Cobra every day. We're not receiving the information. We're not with those scientists, the modelers, the statistician, the epidemiologists, the clinicians. We're not in that room. They're in that room. And at the end of the day, they come out with the decisions
Got to leave
they
it
make.
there. Claire, I'm sorry to cut you short, but we've run out of time. Claire Gerada, thank you very much indeed for coming on the programme. I'm glad that you're better.